Hey guys, so I want to talk with you a little bit more about the mask mandate situation. I wasn't planning to do this again today. When I did the live yesterday about the ruling about the mask mandates being dropped, like literally when people were midair, I didn't think that, I didn't know that I'd be talking about this again, but there's a few things I realized over the course of the last 24 hours that really, really bothered me about this. And I just need to sort of get this off my chest and talk about this a little bit. I'm going to warn you right now, what I'm about to say, my arguments are, if you don't agree with me, you may find my arguments to be one-sided, and that's okay. But it's just really sort of how I'm feeling right now. And what's interesting is I find myself feeling about this mask mandate, the transportation thing, almost like I have at other times during the pandemic, when there have been protests about wearing masks before, about vaccines. I haven't had a video where I've just gone off in a while. Not that I say I'm going to do that, but I'm just saying I haven't felt like this in a while. And so this is my issue, and I have a number of issues. Oh, I got a list for you, but I need to talk about this. So let's be clear. I mean, you can imagine. I'm a family doctor, right? I've said this before. I think masks are important. Studies have shown that they work. Obviously, better masks work better. KN95s, N95s, KF94s, they work better than, cloth masks and surgical masks, okay? But we do know that masks work. So that I think we should be wearing masks in public transportation. That is not my argument, and that's not what's bothering me tonight, but just to level set, that that's already how I feel. So yeah, of course I'm going to be annoyed that there's a federal judge that sort of strikes down this mask mandate for transportation. But really my issues and why I'm bothered, it goes beyond that. And I realized it wasn't just the fact that someone came along and said, oh no, I don't think we should be doing this. So poof, it's gone, poof, be gone, like they do in cartoons. There's a few things. Okay, let me just go down the list, all right? Number one is, first of all, there are people who need to travel and use public transportation that are in vulnerable positions, and they won't be protected the way they were by all of us wearing masks. I'm talking about people who have a weakened immune system, cancer patients, patients with HIV, patients who are on immunosuppressive drugs, etc., with certain genetic conditions or others. Kids, we don't have vaccines for really young kids. They can't get vaccinated. What are they supposed to do? I mean, think about this. For many of you who have grandkids, who have kids of your own, the really young ones, this leaves them vulnerable, okay? So it's not that, people say, oh, well, bars and restaurants. No, public transportation. We're talking about public transportation. There are people that have to take public transportation to get to school, get to work, and they have no choice, right? Now, look, I'm sure there are holes in this argument. I have not made sure that it's iron-proof and ironclad in terms of this little point, but it is something I think about. There are people on public transportation who have no choice but to take public transportation that are vulnerable, either because they can't get the vaccine or they have a weakened immune system or what have you. Now, I'm sure there's an argument one could make, because I haven't thought through all of it, but I think about them, right? Wearing masks for the rest of us is a way that we help them. But that's not even the thing that really makes me annoyed, right? Let's talk about the fact that, this was an argument brought up by somebody on Twitter that I thought was really excellent. When the mask mandates were announced in terms of being dropped, the mask mandate, the transportation mask mandates were dropped. When was it dropped? Like, it was literally dropped in the evening for many of us, right? While people were like literally getting on planes, etc. There are airline stewardesses and people coming on intercom saying, hey, the mask mandate has been dropped. They didn't do anything wrong. My point being is, think about it. If you were someone who was in a vulnerable position, you didn't even have a chance to make a different decision or do something else in terms of travel. You were stuck. You were on that train, you were on that plane, you were on that bus, and all of a sudden they're like, no mask, woohoo! And you're stuck. There was no warning? I mean, think about it this way. At least with Philadelphia, they put their mask mandate back in place. They gave us almost a half a week warning. There was no warning, right? No warning. So if you are a cancer patient, right, and you're trying to get somewhere that you have to get to, maybe to get to your chemotherapy treatments, or you're going to Mayo Clinic, or you're doing something like that, and all of a sudden people around you just ripping the masks off, it could be a very stressful, anxiety-provoking experience that people had last night. I mean, yes, the news outlets are talking about the woo-hoos and the claps and this and that, and they're not necessarily praising them, right? They're talking about them, and it's rightfully so, and it's appropriate. But what about those people who are sitting on that plane that are like, oh my God. Oh my God. What about the people that are like, I have young children, I have a young baby, I have my grandmother, what about those people? Are we thinking about them? I mean, could we have not given folks some notice we're going to do this? I'm not crazy about it. Like, annoyed, bothered by that. It's like, really? Couldn't it say effective May 1st or something like that? No. To help people get where they need to go and then make alternate arrangements? No. Oh, I got more, okay? And then you got airlines that are saying immediately, like, but bam, we're done. Don't blame them. A ruling is a ruling. I'm not going to blame them for that. I do not blame airlines or transportation companies or whatever for following the rule of the law. If they don't have to enforce masks and mask mandates are no longer allowed, they're following the law. I don't blame them. However, Delta Airlines today on its website, I saw this on Twitter, made a statement saying something like they put on their website, now that COVID has transitioned to an ordinary seasonal virus. Ordinary seasonal virus? Oh, so we just went from no mask mandates and now you're gonna call it an ordinary seasonal virus? You're going there? Nobody said this was an ordinary seasonal virus. Two things that are problematic with that. Number one, it's not true, and a lot of healthcare providers clap back on Twitter, and apparently they changed the statement on the website, which is great. Number two, it gives this impression that it's not a big deal. And my problem with the mask mandates for travel going away is that I think that that's one of the main problems and main things it does is it gives this idea that COVID is not a big deal. That it gives people, organizations, companies perhaps a little bit more fuel to say, it's an ordinary seasonal virus, Well, we don't have the mandate. Ordinary seasonal. I mean, just saying. The bigger things though, because I got a few more reasons, and these last reasons are some of the reasons that really bother me the most, right? Because I'm annoyed by those things. But this is the thing. The undermining of the CDC, and Jen Psaki was the White House press secretary, and other people have said this. People who should be making decisions about public health should be public health people, not necessarily people in other disciplines, which is what has happened here. The problem with another agency, organization, type of group or whatever making a decision about public health, think about what that means. Think about this. Is anyone really going to be paying a lot of attention to the CDC in years and time coming forward? Days, months in the future? I mean, I certainly hope they do, but think about it. I mean, basically this ruling in some ways, whether metaphorically, if nothing else, basically says, well, CDC is really not that big of a deal. They're really not that important. I mean, they make suggestions, and yeah, they're public health people, but these are just suggestions. Suggestions. Think about it. The thing that bothers me the most is literally the sort of demotion of the CDC, and not just the CDC, but public health individuals, in terms of their ability to communicate, relay, and recommend what is best from a public health standpoint. If you have people who are not in health making decisions about public health, what does that say for the healthcare organizations? It essentially says, well, we don't really need you. Well, you're sort of important, but you're not that important. Well, you're important, but we don't have to listen to what you say. Well, you're important, we'll maybe consider it, but I mean, we have other ideas too. We can make our own decisions too. And what's the problem with that? The problem with that is that the next time we have another pandemic, the next time some little bug wants to fly over here and wreak havoc, what does that mean? Who's going to be leading us? Now, one would argue the CDC, they'd be saying, well, the CDC, everybody's got thoughts about the CDC. And I hear you. And I am not saying I totally disagree. I have told you I'm a fan of the CDC, but I have been very clear about when I'm not happy with them. Even right now, I'm kind of like, where are you, peeps? Does somebody want to speak up here? Somebody want to say something about what's going on? Literally, I'm like, okay, so we've heard from the White House press secretary. We've heard from Uber and Lyft and Delta and Alaska Airlines and the Florida judge and everything. Hey, CDC, you want to join the conversation? Okay, you want to regain the reins. So no, I'm not really happy with that at all. Because maybe they've made a statement. I haven't heard it. I haven't seen it. And I've been combing Twitter all day. Even at work, I was precepting today, so I wasn't seeing patients. I was overseeing them. And I was kind of just going through the feed just to make sure I kind of kept my pulse on what was going on. Where are you, CDC? But the bigger issue, which is what I was just saying, is, look, this situation essentially lets us know that, well, like I said, CDC is, they're all right. They're nice. They make recommendations. Do we have to follow them? No. Not all the time. Not if you don't want to. Not if you don't like them. Not if someone says you don't. So who's running the ship? Next pandemic, next issue, who's going to be running the ship? Who's going to be running this? That scares me. The other thing, looking at my list, is the way I feel right now, which is how I have felt throughout so much of the pandemic, when basically it's almost like in the US, it's like a civil war. We are fighting one another. This verdict from the judge, once again, has sort of restoked division. I doubt that was the judge's intent. I am sure, or I'm guessing that her intent was to make the best decision she thought she could or would or whatever. But the decision has once again divided our country. We started off this pandemic separated. Okay? Very beginning, we were all in this. Very beginning, we were all scared, scared out of our bejesus. Very beginning. Then things started changing. Shut down. Shut down. Mom's calling. Call you back, Mom. I'm talking, Mom. On a roll. Then people were like, shut down. We can't shut down. Other people were like, we have to shut down. Mom, call you back. Then it was masks. And actually, what's interesting is there were people who were saying in the beginning, I want to wear masks. And the CDC, including myself, when the CDC's guidance was not to wear masks, was don't wear masks. Then that flipped. I saw many people who were like, well, I have the right to protect my family. Then they were like, I don't want to wear a mask. And other people were like, wear a mask. Division. Then the vaccines. Vaccines cause infertility. Vaccines cause this. Vaccines cause you to gain a third arm. COVID vaccines are dangerous. They're this. You know what I mean? It's been a war. This whole pandemic has been a battle. Why do you think I am so preachy? Because I literally feel like it's a small thing it's a small way that maybe I can contribute to this crazy time that I'm living through and that we're all living through. It's my small way. Shush, Alexa. She chimes in at the inopportune times. It's my small way of contributing outside of the office to say maybe I can help someone. Maybe I can explain something in a way that may help someone. It's been nothing but division and contention and fussing and fighting the whole way. And I trust that this judge was making this decision not to stoke the flames, but to make the decision that she thought was right? Because I believe in I hope that that's what she was doing. But the truth of the matter is the decision she made has stoked the flames. They just have. Now I'm not going to speak about her because I can't. But all I know is we're back here again. We're right back here again. I'm up in arms. I'm all pissed off. People are fussing and fighting all over again. Comments, I haven't seen comments like this in months. No mask, no mask. Harassment. It's like, are you kidding me? Are we back here? And so it definitely feels like 3 steps forward, 5 steps back. But this is the thing. I just have to let me collect myself for just 50 seconds. 30 seconds. We're not coming together. We're not coming together. And you know that cases are still increasing, right? I mean, I'm not saying that transportation mask mandates have to be in forever because that doesn't make sense, does it? But do we have to drop them now? Right now? Cases are up. Right now? I mean, some people are saying, I watched some commentary on YouTube today from other doctors, public health specialists. I'm not a public health doctor, saying, well, the data doesn't show that, masks work and da-da-da. I mean, this is what I say. I mean, we know that masks do help some, and better masks help better. Why wouldn't we want to do as much as we can to help the other person? The person sitting next to us, the person sitting across the road, the person who may have the condition that we don't know about. Like right now, while we're in this crazy pandemic and people are still getting sick and people are still dying, even if it's inconvenient, why wouldn't we just say, you know what, I'm just going to suck this up. And if it helps someone else, then that's all for the better, because that's kind of all we have right now. I just don't understand that. And I guess, you know, I don't mean to kind of like just kind of get on here and just go crazy. This division, the divisiveness, the separation, it's almost like right against left, mask versus no mask. We are back where we have been so many different places during this pandemic. And the truth is right now cases are increasing. I mean, would I be like this if cases weren't increasing? No, I wouldn't. Would I be like this if people had maybe been given some notice, been able to make alternate arrangements? No. Maybe not. Maybe. And I also worry. I worry for our public health departments. I worry about the CDC. I worry about doctors too. We don't know everything. But this is the thing. It'd be like, I'm a doctor, right? And, okay, so let me tell you a story. So my sink in my bathroom. Sink, what was it doing? I remember I woke up one morning, turned the sink on, I was like brushing my teeth or something like that. And all of a sudden, it's like the sink was clogged. The water was backing up. I was like, oh, that's weird. Water's backing up. I was kind of like, oh, it must be drained. So I'm like fiddling with it. And all of a sudden I hear shh, like that sound where water is dripping. And I look down and it's the piping underneath the sink. And basically there's there's shooting water out of it onto my bathroom floor. I'm like, oh my God, turn off the water. I'm getting towels and I'm doing this and doing this. And so what do? I call a plumber. Now, how smart would it be for me, who has a leak in my sink, I don't know what the heck to do, to then call a plumber, which is the right thing to do, but then to tell him or her what they need to do? How am I going to tell them what to do with my sink? How am I going to tell them after all the years of training and apprenticeship and study and whatever they've done, but to say, well, actually, no, I mean, I don't want to do it that way. Let's do it a different way. Or how about you try it this way? They would look at me like I was crazy. And they should. And they would probably say, well, you must not want your sink fixed, do you? And they should say that. Which is exactly what I'm concerned about with the way things are going. I am not saying that medical people know everything, because Lord knows we do not. But what I do say as a doctor is I respect people in their different professions. Whether you're the person that helps me with my car, the gentleman who came up and helped me with my sink, the cooks in restaurants who make food that I love to eat, the tax accountant who just did my taxes over the weekend. I respect what you do, and I respect your training, and I respect your expertise. And I respect and will listen, so long as there's no reason why I shouldn't, to the advice you give me when I need help. Because if I need help, then probably should be listening. And that's what I'm talking about. It's like, okay, so is everybody going to be making public health decisions here? And what this message sends to me overall is, well, shoot, CDC's recommendation, well, they just make suggestions. Well, yeah, I mean, we do some of their suggestions. Well, sometimes they're right, sometimes they're not. Sometimes we do it, sometimes we don't. It's not really that important. I mean, you know, do what you want. Is that really the road we want to go down? I don't think it's smart. I don't think it's safe. I think there's room for discourse and dialogue, room for even debate. But I do believe in those people who are experts to be leading the way. I mean, I lean on and respect the people who are our military personnel, keeping our country safe. What am I going to walk in and say, well, you know, General, I don't know about that. Come on now, as my uncle would say, come on now. That's all I'm asking. I'm just saying, let's just use, I don't want to say common sense because that sounds demeaning. I don't mean it that way, but does it make sense? Do you go to your Botox lady and tell her, you know, actually, I think I'd like to try this myself? Or I don't know that you're doing it right. Do you do that? I don't know that you do. So It's going to be interesting, y'all. I don't know what's going to happen. I wish the CDC would make a statement. I wish they would say something. I wish they would stand up and say something and be present in this discussion. It sounds like the Biden administration may appeal the ruling, but that's not even where my mind is at right now. I just feel like, what are we doing? Any Tom, Dick, or Harry, is that what they say? Is that the phrase? Can make a decision now about public health. And that's scary. Because I don't want anybody making decisions, just anybody making decisions. I want people who do public health to make decisions about public health. I'm a doctor. I'm not public health. I'm a family doctor. I don't have a degree in public health. Most doctors don't. Many do, but most don't. I want public health people making decisions about public health. Weigh in. Let me know what you think. It's almost about maintaining the integrity of of our nation's ability to fight something like this. And right now, we're not doing a good job. Anyway, I'm not going to keep going on, but dismissed. You guys are amazing, by the way. Thanks for letting me rant. Let me know what you think. I want to know. Do you agree? Do you disagree? What points have you thought of? What matters to you? I will be wearing my mask in public transportation. Just doesn't seem like a reasonable reason not to. I encourage you all to do so as well, because that is still the recommendation of the CDC. They still recommend masks. Obviously, you have a choice, but I say if you can do something, a small thing to help someone else potentially, if we can all do something small that will help other people, why wouldn't we do it? Or let's consider doing it. So, I don't know. I'm just glad you guys are here. Thank you for listening. I'm sorry for the rant. Let me know what you think. Thank you for the stars. I'm seeing you guys now, and I know I'm just like running off at the mouth, but thank you for the stars. Join my group called I Got the COVID Vaccine. A lot of people in that group are discussing what's happening right now, weighing in. So if you want to weigh in, join that group. It's in the pinned comment. Okay. Also, if you've not liked and followed my page, please do that, because I got videos for you every day about something. So, love you guys. I just hope we get through this in one piece. And I don't mean it like that. I'm a doctor, so I shouldn't joke like that. I just hope we get through this with a sense of leadership and direction and guidance, and that we all feel aligned. Because right now, we are all over the place. We are all disjointed, and we're fighting one another. And fighting one another is not going to get us through this pandemic. All right. That's it. Love y'all.